Hi, I'm Lieutenant Governor Kathy Hochul. We all know that the impact of the coronavirus has hit our families hard. People all across the state of New York who never thought they'd be out of a job are finding themselves with financial stress, perhaps for the first time, worried about how they're going to take care of their families. We also have seniors who need to be engaged with their family members, their children and grandchildren, who are now socially isolated and getting depressed. We have children who are just uncertain of what to do next, teenagers who are so stunned to be out of school and some of them missing celebrations like their graduation. This is a tough time for New Yorkers. But the good news is we have resources available to help. Our Office of Mental Health has incredible individuals prepared to answer calls and talk people and help them teach them how to cope with something that none of us could have foreseen and all of us are in together. At this time, I'd like to take the opportunity to introduce the leader of this institution, this organization, which is out there fighting to protect not just our physical health, but our mental health as well. And that is Dr. Anne Sullivan, our commissioner. Dr. Anne Sullivan, thank you for all you do on behalf of New Yorkers.
Thank you, Lieutenant Governor Hochul, and thank you and Governor Cuomo for your outstanding leadership in this difficult time. I think one of the most important things is to take care of the physical health of the New Yorkers, but you and the governor have also paid a great deal of attention and really emphasized the mental health of New Yorkers as well. So, welcome everyone. I'm Dr. Anne Sullivan, the Commissioner of the New York State Office of Mental Health, and I'm pleased to be here to talk with you today about stress and anxiety and the COVID-19. As the Commissioner of the New York State Office of Mental Health, I have two big responsibilities at this time. One is to make sure that the mental health services for all New Yorkers are available and open and providing the needed care that New Yorkers may want at this particular time. So we have initiated a great deal of telepsychiatry and telemental health to enable individuals who need to have mental health services to access them, even while they may be isolating or staying at a distance from their caregivers. But we're also very involved in making sure that all our crisis lines and all our crisis services are available. But in addition to providing services, making sure they're there for individuals who have mental health needs, the governor has asked us to provide a very special emotional health line. The support emotional health line is there for all New Yorkers who may be undergoing the stress and anxiety associated with COVID-19. The helpline is there for you to talk about what might be bothering you in particular about going through this difficult period of time. So, for example, we've had calls from individuals who are loved ones of healthcare providers who are concerned about their loved one working in the healthcare environment, but are kind of not so comfortable talking with them about it because they don't want to upset them. We have had calls from isolated elderly individuals who feel very much alone at this point in time and want to know how to deal with that. And we've had calls from parents who want to know how to talk with their youth and their kids, little ones and teenagers, about COVID-19. So the emotional support helpline is there for you, all New Yorkers, and you can call the number, which you can reach on our OMH website, but I'll give you the number now too. It's 844-863-9314. So everyone is welcome to call and talk if they're feeling stress or anxiety about mental health issues. If you are in an emotional crisis, or if you are experiencing severe mental health problems, then I suggest instead of calling the emotional support line, you work within our crisis system. Call your county crisis line or call, text 5 to 741-741, or our suicide and emotional distress hotline, which is 1-800-273-TALK. So all those other lines are available. But if you really want to just talk about some of the stress and anxiety that you're experiencing about the current crisis, then please call our emotional helpline. So now what I'd like to do is give you a few helpful hints on how to deal with stress and anxiety. It's going to be a very brief webinar, but it's going to point out a few things that I think could be helpful to everyone who's currently dealing with what's a very challenging and stressful situation. So I'd like to move now to a brief presentation. We'll begin with a slideshow. The first thing I think it's important to consider in managing stress and anxiety is that it affects people in different situations differently. So first we're going to talk about some tips for everybody, then some tips for people who are currently receiving mental health services, then a few extra special helpful hints for parents dealing with their youth, and then especially for older and vulnerable adults. So first of all, for everyone, the first important thing to do is to take control as much as you can of the situation. And what does that mean? That means following all the helpful hints that are out there about how to be sure to keep yourself safe. So if you're sneezing or coughing, cough into a tissue or cough into your arm and then throw that tissue away. And then wash your hands regularly. Can't emphasize enough how important it is to wash your hands again and again and again. When you get home, wash your hands. When someone drops off a package at your house and you bring the package in, wash your hands. If you have contact in the supermarket, when you get home, wash your hands. So I think washing your hands is really one of the very, very first and most important things that anyone can do to be helpful in controlling your exposure to the virus. And then think about your daily routine. Think about the kinds of things that you do. And if you should, unfortunately, become ill, what you would do. Have a little bit of a plan for what next steps might be. If you had to work from home, or if you're already working from home, or if you had to arrange other child care arrangements. Another critical point is social distancing. And I know that this is difficult for everyone, but it is so, so important. So that important rule about staying 6 feet away from someone if you can, or as far away as you can when walking down the street or in a supermarket or even going to the pharmacy. Stay home as much as possible. The governor has said that only essential workers should be going out to work and that all non-essential workers should be staying home. We're going to talk a lot about tips about what to do about when you're home. Keep that 6-foot distance, and then, but continue, and this is one thing I'm going to continue to say throughout the presentation, continue to keep social contacts ongoing, even if you're home alone, and we'll talk a lot about how to do that. Another key point is managing information flow. You know, I think what I hear most from people is, oh, I don't know if I can stand hearing any more about the virus. It makes me so anxious. It makes me so uncomfortable. What we suggest is that you only get a limited amount of information each day. Tune into the governor's presentation. He gives some of the best information for healthcare providers and for the general public. Or you can tune into maybe one news channel that you trust. Go to sources that you trust, the CDC, the Department of Health website, sources that are going to give you facts and useful information. Try to stay away from lots of Twitter and social media where people are just talking about their anxieties and fears. It only can make anxieties and fears grow more. So get your information every day if you want to, but limit it. Set boundaries, and only check a couple of times a day. Now, monitoring your own anxiety, this is something just to keep in mind. We're all going to be anxious during this period of time, and anxiety for everybody shows itself in different ways. So some of us might just get a little more irritable than we usually are. Sometimes we don't sleep so well. Sometimes we may have a stomach ache or a headache. But the reality is, those are typical stress reactions. Look at them, and then do some of these tips we're talking about today to help decrease that anxiety. If that gets worse, if it's something where you really begin to feel that you can't cope with anything that you're doing, that your daily activities are being significantly interrupted, you can't concentrate, you're finding yourself getting hopeless and severely worried, then call a mental health provider for assistance. That's the time that it makes some sense to reach out. Don't be ashamed about that. Don't feel like that's something bad to do. Just do it. Because just like if you have some symptoms or you're feeling ill, you're going to reach out to a healthcare provider. Reach out if some of those symptoms get worse. And then self-care. Self-care is critically, critically important. Please don't forget this. Take care of yourself. Exercise when and where you can. Maybe get outside if you can. And reach out to friends, colleagues, people you can talk to online, people you can talk to on the phone. I don't think anybody feels pestered at this point in time or bugged if you call too much. People are waiting to hear from you. Call friends. Call even distant relatives. Call people who perhaps you haven't talked to in a long time. I think everyone is glad to hear from someone now. And then try to do something for someone else. I think, one of the things that makes us all very human is our ability to help out others in times when we need help. So think about calling a neighbor who you think, he doesn't have too many friends. I think I'll call him or her. Or maybe a relative that you don't talk to too regularly. Just call and say hi. Or be part of a chain of people who call, which is growing across the country, people who call elderly individuals who are home, who are isolated. So think about how you can help in your community virtually. And I think there's a lot of suggestions going on like that, and I'm sure you can find them in your particular community. Another thing is just use your time to think about and talk about things other than the COVID virus. You know, I had a friend who told me they never really paid much attention before to the Discovery Channel or some of the interesting things on the internet, and now they have a little time to learn about things they never knew before. So I would suggest you begin to look at things you can see online, learn. You know, we always say, geez, I wish I had the time to learn or do that, so do it. Do things that can be enjoyable, can be helpful, and also think about giving yourself just a few minutes sometimes to breathe, take a deep breath, think about something positive, do some good positive imaging. Those kinds of techniques are all very, very helpful. Now, if you are receiving mental health services, please be proactive with your provider about setting up a coping plan, and your provider will help you with this. If the anxiety is getting worse, don't feel like you can't talk about it, talk about it. They will help you develop a plan that will be helpful. And if you need that coping plan, it should include things like how to deal with the anxiety when you feel it's getting worse. It should include things like making sure you have access to your medications and there won't be any interruption, and also how to contact the person that you're working with, perhaps by phone, perhaps by telepsychiatry or telehealth. There's all kinds of ways to keep in touch, and sometimes very brief contacts can be helpful. And then throughout the state, we have a number of peer support lines, peer warm lines, and peers who are willing to talk to you because they're also going through the same emotional problems and would be very glad to work with you on how to cope and get through these difficult times. So if you are receiving mental health services, reach out, and please be aware that everyone is there to talk to you, to contact you. Even if we can't do it in person, we will be doing it virtually, and that can be extremely, extremely helpful. Now, if you're a parent, I know that you might have some anxiety about how to talk with your child about this. And obviously, there's a difference depending upon how old your child is. For the younger kids who are in school, they've heard about this. In fact, they know school's closed. So you probably already explained to them why school is closed. But if they continue to talk about the virus, if they talk about anxiety, listen to them. Don't try to brush it aside and say, oh, it'll all be okay. Listen to their concerns, and then try to answer them as you would as any parent at the level that they are at. So that if a child comes to you and says, why can't I talk to Grandma and Grandpa? Why aren't they coming over to the house like they used to? You could say, well, Grandma and Grandpa are staying home because we want them not to catch the virus, and you'll be able to talk to them on the phone and leave it at that. You know, you don't have to go into large explanations with young children, but I think you do want to be open to their questions. Never give them a hard time about asking the questions or look too uneasy. Just try to be calm and answer their questions. With teenagers, I think it's also important to talk to them pretty directly. I mean, teenagers I think can hear directly what some of the issues are and talk to them about their risks directly, but also how they can be so helpful to other people. You know, there are a lot of media pictures of youth on the beach not paying attention to all the things. But I think the reality is if we really talk to our young people and we really explain to them that we need them at this point in time to kind of socially isolate, to work virtually, to talk virtually with their friends, because we don't want to hurt our elders. We don't want to spread this virus. I think they'll respond. I think it's how we approach them. I think the youth are really very, very responsible, and they want to be able to do something to help. So maybe have a teenager call an aunt or an uncle that they haven't talked to in a while and say hi, or call a neighbor, and let them feel that they're a part of not just staying home, but of fixing the problem, of helping others. And I think that can be a very strong motivator for youth. With kids especially younger kids, keep a routine. Have a breakfast at a certain time. Try to have lunch at a certain time. Maybe certain activities at particular times. Kids love routines, even though they may balk at them a little bit. And I think it also helps the parents. So keep that in mind. And then physical activity is always important. And to the extent that you can go outside, keep that social distance kind of. But, kids can ride bikes. Kids can go out and run around. There's a lot of things they can do with you. Do that physical activity. It's really very, very helpful. And you know that energy kids have. It helps them to go outside. Now, if you're a caregiver of an older adult, I think that there's something special here that we have to consider. Because older adults tend to be, in many situations, not always, but many situations, to be more lonely and isolated. So please keep up the contact. And even a brief daily contact even for a few minutes, makes a huge difference. So please keep that in mind, whether it's a phone call or a face-to-face or a, Zoom or a Skype or whatever you do, to make sure that you keep contact with individuals who might be getting increasingly isolated during this time. And, sometimes you can use that teenager in your house to help the older adult virtually to figure out how to use that computer so that they can actually talk face-to-face. So get everybody involved in being helpful with other people. It's very, very helpful. And there's also, if you go into your local, areas and your local communities, I'm sure there's also chat lines and things that are going on that are positively focused that I think could be very helpful for individuals who are older. Stay active to the extent that you can. Volunteer if it's safe and appropriate to volunteer. People do need help, and we've had in the state, when the governor has put out a request for healthcare volunteers, he's got an enormous response. And I think that I'm sure in other communities there are other individuals asking for volunteers. If you can, and if it's safe for you, and if you're not a vulnerable population, and you feel you can volunteer, then consider that. I think that is, we all feel better sometimes when we can help others. And then lastly, I'd just like to end with one more emphasis, which I began with, which was self-care. These are difficult times. They're very demanding times, and we have to take care of ourselves. So please find a way to give yourself some breaks, give yourself a little bit of a breather, give yourself a little rest time. Know that it's very important that you take care of yourself. We can't take care of others unless we take care of ourselves. So what I would like to do, that's the tips. I hope that they are helpful. And what I would like to just end with is to thank you, first of all, for listening, to wish you, on behalf of the governor and the lieutenant governor, that you stay well and healthy. And also, please know that we are there for you, and that if you need to talk to us, whether it's on the emotional helpline or in any of our other crisis services, please contact us. We are here. We are staying open and available to you, and we will do everything we can in getting through this crisis. And as Governor Cuomo has said so many times, we are in this together, and we're going to get through it together. So thank you so much for listening.